Hello everyone, my topic today is urolithiasis in small ruminants. But before this video, I hope that this concept would be super duper clear to you. Firstly, I'm gonna talk about the definition of urolith. The composition of urolith, also called urinary stone or calculi, varies with the part of the country that the animal lives in. For example, in guts, calculi usually comprise of phosphate salt, especially apatite, which is calcium phosphate, or more commonly starvate, which is magnesium ammonium phosphate hexahydrate. Now, the definition of urolithiasis. Urolithiasis is a disease in which small calculi, which is stone or crystals, form in the urinary tract and is likely linked to or certainly affected by diet. Urolithiasis is the most common problem in male small ruminants, and this because the male ruminants have a long narrow urethra, narrow urethra, and at the end of this urethra we have urethral process, which is particularly narrow. So fine calculi found often form in the urinary system but are often excreted with the urine. However, in males, they can become trapped and block the normal flow of urine. So this urolithiasis problem because urinary calculi or stones are caused by precipitations of minerals, which is a high level of minerals tend to be crystallized and aggregates in the urine forming calculi. These pictures illustrate the male gut urinary system, which is especially in castrated male guts. The narrow urethral process illustrate narrow urethral process, of course, can undeveloped and atypical sites for urinary tract obstruction. The gut urinary tract consists of two kidneys here and uterus, which is small tube that the drain urine from the kidneys into the bladder, and we have the bladder, of course, here, which is urine stored inside of it, and we have a long narrow urethral, and at the end of it we have urethral process. Castrated male kinds are most prone to urolithiasis, but the latter can also be observed in kinds that are fattened for meat and or bit guts. Young adult male shape and guts will often strands and plead with discomfort with urolithiasis and other obstructions of urinary tract. So they sometimes try to kick their abdomens as signs of discomfort. Nice to know that male ruminants with urolithiasis will often have dried crystals around the urethral process or in the hair surrounding the purpose, which is skin covering the penis, which will be dry due to obstruction, of course. The relationship between urolithiasis and diet. Urethral obstructions caused by urolith is most common see in show or bit guts and lambs that have a high grain, low refuges diet. So diets that are high in grain, phosphorus and magnesium, and low in refuges, which is hay, such as hay and or fresh grass, and calcium will increase the risk of phosphate urolith formation. In normal case, a ruminant will remove phosphorus from their body by excreting it into saliva and then out through the feces, which is manure. But high grain, low refuges diet decreases the formation of saliva, so extra phosphorus must be removed from the blood by the kidneys and then excreted into the urine. So when diets are too high in phosphorus, the urine phosphorus levels become excessively high, and the phosphorus settles into stone like pellets that can be too large to be passed. So these uroliths increase the risk of urinary tract infection and may result in life-threatening blockage of urethra. It's a nice formations that some breeds of sheep, for example, Texel and Scotch blackface, may be predisposed to stone formation because they tend to excrete phosphorus through the urinary tract rather than the saliva and feces. Finally, I gonna talk about the signs and symptoms that the signs and symptoms in urolithiasis in small ruminants. We have early clinical things and we have late clinical things, of course. In early clinical things, we found blood in urine, and we found straining to urinate, and decreased urine production, of course, as a result of trapped and blocking the normal flow of urine. And we have, of course, painful urination, prolonged urination, also tail flashing, and of course abdominal pain. In late clinical things we have loss of appetite, lethargy, and which is the animals feeling depression, abdominal swelling, and at the last things is swelling around the purpose, of course, which is skin covering the veins. At the end of my presentation, have a good day, and bye bye.